5 warning signs your joint pain could be something serious. Hello there, and welcome to today's video. Have you ever woken up with a twinge in your knee or a stiffness in your shoulder and wondered, is this just part of getting older, or should I be concerned? If you have, you're not alone. Every year after 70 is precious, isn't it? These golden years should be filled with the activities we love, time with family, and new adventures. But sometimes, pain, especially joint pain, can get in the way of living life to its fullest. Today, I want to talk about something many of us experience but might not always know how to interpret: joint pain. While aches and stiffness are common as we age, there are certain warning signs that your joint pain might be something more serious, something that needs medical attention rather than just a heating pad or over-the-counter pain reliever. In the next few minutes, I'll share with you 5 warning signs that your joint pain could be something serious. Understanding these signs could help you protect your mobility, independence, and overall health for years to come. Warning sign number 1. Sudden, intense joint pain. The first warning sign to watch for is sudden, intense joint pain, especially when it occurs without an obvious cause like a fall or injury. Our bodies typically don't suddenly develop severe pain without reason. If you experience a sharp, intense pain that seems to come out of nowhere, this could indicate several serious conditions, including a small fracture you might not be aware of, crystals forming in your joint as happens with gout, inflammation from certain types of arthritis that can flare up quickly. What makes this type of pain concerning is how dramatically it can appear. You might go to bed feeling fine and wake up barely able to move your joint. This isn't the gradual stiffness many of us feel in the morning. It's a different level entirely. If you experience this kind of sudden, severe pain, especially if it's accompanied by warmth in the joint area, it's important to contact your doctor promptly. Early treatment can prevent further damage and help manage what might be an underlying condition. Warning sign number 2, visible swelling and redness. Our second warning sign is something you can actually see: noticeable swelling and redness around a joint. Healthy joints shouldn't appear swollen or red. When you notice these visual changes, your body is sending you a clear signal that something inflammatory is happening. This swelling occurs because extra fluid rushes to the area, either as part of your body's healing response or because of an underlying condition. What's particularly important to watch for is swelling that makes one joint look noticeably larger than the same joint on the other side of your body, skin that feels warm to the touch over the affected joint, redness that doesn't fade quickly, swelling that doesn't improve after a day or two of rest. These visible signs often indicate inflammation that could be related to an infection, rheumatoid arthritis, or other conditions that require proper medical care. While it might be tempting to just wait and see, persistent swelling and redness are your body's way of asking for help. Tom's story: when ignoring pain led to complications. Before we continue with our next warning sign, I'd like to share a story about someone who learned the importance of these warning signs firsthand. Tom was a 72-year-old retired carpenter who had always been active, enjoying gardening and weekly bowling with friends. When he first noticed swelling in his right knee, he brushed it off as just another sign of aging. "I've had aches and pains my whole life," he would tell his daughter when she expressed concern. The swelling persisted for weeks, but Tom continued his regular activities, just pushing through the discomfort as he always had. He tried over-the-counter pain relievers and knee braces from the pharmacy, but the swelling continued to worsen, and the knee became increasingly warm to the touch. It wasn't until Tom couldn't get out of bed one morning due to the pain that he finally agreed to see his doctor. The diagnosis? A joint infection that had progressed significantly. What could have been treated easily weeks earlier now required stronger interventions, including 4 antibiotics and a longer recovery period. Today, Tom makes a point of telling his friends at the bowling alley, "Don't be stubborn like I was. Our bodies talk to us for a reason." Tom's story reminds us that ignoring persistent warning signs can lead to more serious complications and longer recovery times. Now, let's continue with our third warning sign. Warning sign number 3, joint pain with fever or illness. Our third warning sign is when joint pain occurs alongside other symptoms of illness, particularly fever. When joint pain appears together with signs of illness like fever, fatigue, or generally feeling unwell, It suggests that your body might be fighting something more than just mechanical joint issues. This combination of symptoms can indicate an infection in the joint itself, which is a medical emergency, systemic inflammatory conditions that affect multiple body systems, certain autoimmune disorders that can impact both joints and overall health. What makes this warning sign particularly important is that infections in joints can progress quickly and cause permanent damage if not treated promptly. Even a low-grade fever, just a degree or so above your normal temperature, when combined with joint pain warrants attention. Don't dismiss these symptoms as just coming down with something. If you're experiencing joint pain along with fever, chills, or unusual fatigue, contact your healthcare provider right away. This combination of symptoms deserves prompt medical evaluation. Warning sign number 4, pain that wakes you at night. Our fourth warning sign is joint pain that's severe enough to wake you from sleep. Sleep is when our bodies typically get relief from pain. Our muscles relax, we're not putting pressure on our joints, and our pain perception often decreases. So when joint pain is intense enough to interrupt your sleep, it's telling you something important. Night pain can be associated with more advanced forms of arthritis, bone problems, including certain types of bone loss or rarely tumors, nerve compression that worsens when lying down. What makes this type of pain particularly concerning is that it can create a cycle of sleep deprivation that affects your overall health. Poor sleep can increase pain sensitivity, weaken your immune system, and reduce your quality of life. If you find yourself regularly waking up because of joint pain, or if you can only fall asleep in certain positions to avoid pain, these are signs that should prompt a conversation with your doctor. There may be treatments available that can address the underlying cause and help restore your restful nights. Warning sign number 5, loss of joint function or mobility. Our fifth and final warning sign is perhaps the most impactful, a noticeable loss of normal joint function or mobility. This warning sign goes beyond pain to affect how your joint actually works. You might notice difficulty with movements that used to be simple, like gripping a coffee cup or turning a doorknob. A joint that feels unstable or gives way unexpectedly. A reduced range of motion, where you can't move the joint as fully as you once could. A locked feeling, where the joint seems to get stuck or can't complete its normal movement. These changes in function can happen gradually, but they should never be dismissed as just getting older. While some minor stiffness is common with age, significant loss of function often indicates structural problems within the joint that may be treatable. The reason this warning sign is so important is that it directly impacts your independence and ability to perform daily activities. The good news is that with proper diagnosis and treatment, many causes of lost joint function can be improved or managed effectively. When and how to seek help. Now that we've discussed these 5 important warning signs, let's talk about when and how to seek help. If you recognize any of these warning signs, the first step is to contact your primary care doctor. They can perform an initial evaluation and refer you to specialists if needed. When you call for an appointment, be sure to mention which specific warning signs you're experiencing, how long you've been having these symptoms, what makes the pain better or worse, any other health conditions you have. Don't wait for symptoms to become severe before seeking help. Early intervention often leads to better outcomes and may prevent permanent joint damage. Before your appointment, it can be helpful to keep a simple pain journal for a few days, noting when your symptoms are worst and what activities seem to trigger them. This information can be valuable for your healthcare provider in determining the cause of your pain. Remember, seeking help isn't a sign of weakness. It's a wise decision to protect your health and quality of life for years to come. As we come to the end of our time together today, I want to thank you for joining me to learn about these important warning signs. Your joint health matters because it's directly connected to your independence and ability to enjoy these precious years. To summarize what we've discussed, the 5 warning signs that your joint pain could be something serious are: sudden, intense pain without obvious cause, visible swelling and redness, joint pain accompanied by fever or illness, pain that wakes you from sleep, loss of normal joint function or mobility. I'd love to hear from you in the comments section below. Have you experienced any of these warning signs? What did you learn from today's video that you found most helpful? Your experiences might help others in our community recognize when they should seek help. If you found this information valuable, please consider giving this video a thumbs up and subscribing to our channel for more health information designed specifically for our generation. And if you know someone who might benefit from this information, please share this video with them. Remember, paying attention to these warning signs isn't about focusing on the negative, it's about protecting your ability to live life fully and independently. Each year is precious, and taking care of your joint health is one important way to make the most of every one of them. Until next time, take care of yourself, and I'll see you in our next video.